we take these few minutes to interrupt your program. Hi, I am a nurse practitioner working in a clinical area. Every day the nursing shortage greatens. We need your help. Become a nurse practitioner, save a life. Nurse practitioners are valued and respected medical personnel. They work day in and day out with numerous patients, often providing the same quality care as physicians. Many times, they are the primary healthcare provider for the patients. Nurse practitioners focus on the patient's conditions and the effects of their illnesses on the patient's lives and families. One of their largest responsibilities, other than the immediate care, is to educate patients about their health and well-being. Nurse practitioners can be found caring for people of all shapes and all sizes. They work with family care, geriatric care, and pediatric care patients, to name a few. They can also be found in hospice care, home health care, and surgical and recovery care.
There are many organizations available to nurse practitioners and their teams to better care for patients. The largest organization is the American Academy of Nurse Practitioners, promoting excellence in nurse practitioning, education, and research. Another extensive program for nurse practitioners is the National Association of Pediatric Nurse Practitioners, promoting the highest standards of health care for children. One final organization is developed through the American College of Nurse Practitioners. They strive to keep a strong policy and up-to-date care that enables nurse practitioners to continue providing high-quality health care to their patients. In addition to organizations available to the numerous nurse practitioners, there are multiple written work resources available. There are textbooks, journal articles, newspaper clips, and internet networks, to name a few. Some of the most extensive databases available to nurse practitioners include Medline, the New England Journal of Medicine, and the Journal of American Medical Association.
To become a nurse practitioner, there is a set number of steps in education. Before starting college, a potential nurse practitioner must earn a high school diploma. The next step is to find a college and graduate with a Bachelor of Nursing Science degree. 1 to 2 years of experience in nursing fields is generally required before entering the master's program for nurse practitioners. Just recently, the nurse practitioner master's program developed into a doctorate program. After receiving the doctorate of nurse practitioning degree, the new nurse practitioner must become nationally and state qualified and credited. The nurse practitioners must first pass the NCLEX RN to be certified as a registered nurse. After becoming an RN, licensed by the state, the nurse must then acquire a national license. A nurse practitioner must then be certified by an organization such as the American Academy of Nursing Practitioners or the American Nurses Credentialing Center in order to become a titled nurse practitioner.
Nurse practitioners, once properly titled and licensed, can begin their practice of helping and improving the health care of patients. On average, a nurse practitioner makes about $82,590 a year. Many nurse practitioners work alongside licensed physicians. However, some states do allow these nurses to develop their own practices. With or without physician counterparts, nurse practitioners work hard to see numerous patients and improve overall health care. For patients' benefits, seeing a nurse practitioner is often cheaper than visiting a physician. Nurse practitioners are wise, caring, educated, and lively people. They work only to improve the health care of the world and the individual health of the people. They are the future of great health care.
Nurse practitioner.
Nurse practitioner.
Nurse practitioner.
Nurse practitioner.
The care for today, the hope for tomorrow.